Today we will discuss MDMA overdose. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. MDMA, often called ecstasy or Molly, is a drug that affects mood and perception. An overdose occurs when someone takes too much of it, which can lead to serious health problems. Signs of MDMA overdose. 1. Extreme confusion, feeling very disoriented or unable to think clearly. 2. High heart rate. A rapid heartbeat can indicate stress on the body. 3. High blood pressure. This might cause headaches or other symptoms. 4. Fever. A dangerously high body temperature, hyperthermia, can occur. 5. Nausea or vomiting. Feeling sick to your stomach or actually throwing up. 6. Severe anxiety or panic attacks. Overwhelming feelings of fear or anxiety. Loss of consciousness. Feeling faint or passing out. What to do? If you or someone else is experiencing these symptoms after taking MDMA, it's important to seek medical help immediately. Overdosing on MDMA can be life-threatening, and prompt treatment is crucial. If someone might be having an MDMA overdose, here's what to do. 1. Stay calm. Keep a cool head to help them. 2. Call for help. Dial emergency services right away. 3. Keep them safe. Move them to a cool, quiet place. 4. Monitor their breathing. Make sure they're breathing okay. 5. Stay with them. Don't leave them alone until help arrives. 6. Offer water. If they're conscious, give them water, but don't force it. Act quickly and don't hesitate to get help. In the hospital, here's what doctors typically do for someone who has an MDMA overdose. 1. Check vital signs. They'll measure heart rate, blood pressure, and temperature. 2. Cool the body. If the person has a high fever, they will cool them down with ice packs or special blankets. 3. Give IV fluids. They might provide fluids through an IV to keep the person hydrated. 4. Monitor heart and breathing. They'll keep a close eye on how the heart and lungs are doing. 5. Medications. They may give medicines to help with anxiety, seizures, or other symptoms. 6. Supportive care. They'll provide care to help stabilize the person until they're out of danger. The goal is to ensure the person is safe and to treat any serious symptoms. For MDMA overdose, healthcare providers may use several specific medications to manage symptoms. Here are some commonly used ones. 1. Benzodiazepines, e.g. lorazepam or diazepam. These help reduce anxiety and prevent seizures. 2. Antipyretics, e.g. acetaminophen or ibuprofen. These are used to lower fever. 3. Fluid replacement. While not a medication, intravenous fluids are often given to prevent dehydration. 4. Cooling agents. Medications may be used to help manage hyperthermia, high body temperature. 5. Activated charcoal. In some cases, if the overdose is recent, this may be administered to limit further absorption of the drug. 6. Supportive care medications. Depending on symptoms, other medications might be used to address specific issues like heart rate or blood pressure. These medications are administered based on the patient's specific symptoms and condition. Always follow medical advice in emergencies. People at higher risk of an MDMA overdose include 1. New users. Those who haven't taken MDMA before might not know their limits. 2. High doses. Anyone using a lot of MDMA at once is at greater risk. 3. Mixing drugs. Combining MDMA with other substances like alcohol or other drugs increases danger. 4. Hot environments. Being in a crowded or hot place, like a club or festival, can raise body temperature and risk. 5. Underlying health issues. People with heart problems, mental health issues, or other medical conditions are more vulnerable. 6. Dehydration. Not drinking enough water while using MDMA can lead to serious problems. Awareness of these factors can help people make safer choices. Now you need to watch my video on bronchiolitis or have a look at metabolic acidosis.